In managing Kawasaki disease, it's crucial to understand aspirin use. Parents should not stop aspirin if a fever develops without consulting a provider. This is due to risks like Reye's syndrome and coronary complications. Monitoring for bleeding and giving aspirin with food are correct actions. The medication helps prevent heart problems, emphasizing the need for proper guidance. For a child with nephrotic syndrome and severe edema, monitoring daily weight is the priority. This measure accurately reflects fluid retention and treatment response, guiding other interventions. While corticosteroids, sodium restriction, and diuretics are important, weight monitoring is essential for effective management. In cases of bronchiolitis from RSV, questioning the order to administer antibiotics is key. RSV is a viral infection, and antibiotics are not indicated unless there's a secondary bacterial infection. Suctioning, humidified oxygen, and elevating the head are appropriate supportive measures. For a child in sickle cell crisis, questioning the use of meperidine for pain control is crucial. Meperidine poses a risk of neurotoxicity. Safer opioid choices like morphine or hydromorphone should be considered. High-flow oxygen, IV hydration, and blood transfusions are appropriate interventions. In cystic fibrosis, administering pancreatic enzymes correctly is vital. Enzymes should be given immediately before or with meals to aid digestion and nutrient absorption. Giving them after meals decreases effectiveness. Avoid crushing capsules or mixing with acidic foods to ensure proper function. For infants with congenital heart disease showing poor feeding and increased breathing effort, notifying the provider for possible hospitalization is the priority. This ensures urgent evaluation and intervention. Small feeds, diuretics, and positioning are supportive but secondary to immediate assessment. In diabetic ketoacidosis, DKA, a low serum bicarbonate level supports the diagnosis. DKA presents with metabolic acidosis, hyperglycemia, and ketonemia. Monitoring blood glucose, pH, and potassium are important, but bicarbonate levels are a hallmark finding in DKA management. Post-tonsillectomy, frequent swallowing may indicate bleeding. Assessing for active bleeding is the first step. Offering ice chips, administering analgesics, and encouraging rest are supportive measures, but secondary to ensuring there's no bleeding, which requires immediate attention. In suspected esophageal atresia, coughing and cyanosis during feeding indicate a high aspiration risk. Immediate notification of the provider is crucial for surgical evaluation. Inserting a nasogastric tube, administering oxygen, and keeping the infant NPO are supportive but secondary actions. For acetaminophen ingestion, obtaining serum levels is the priority. This guides the need for antidote administration. N-acetylcysteine is most effective within 8 hours of ingestion. Activated charcoal and poison control are important but follow the initial assessment of serum levels. When administering the MMR vaccine, a history of anaphylaxis to neomycin contraindicates vaccination. Mild cold symptoms, sibling immunodeficiency, and teething discomfort do not prevent vaccination. Ensuring safety by reviewing medical history is essential in vaccine administration. In leukemia, patients receiving chemotherapy, a fever requires immediate intervention. It may indicate a life-threatening infection in immunocompromised children. Bruising, fatigue, and hair loss are common, but less urgent compared to the potential for severe infection. For suspected epiglottitis, preparing for intubation is the priority due to airway obstruction risk. Throat examination is avoided until the airway is secured. Obtaining cultures, administering antipyretics, and starting IV fluids are secondary to ensuring airway safety. In intussusception, current jelly stools are characteristic. This finding, due to bowel ischemia, is a classic sign. Watery diarrhea, projectile vomiting, and pale stools may occur, but are not as definitive as current jelly stools in diagnosing intussusception. In sickle cell crisis, maintaining adequate hydration is crucial. It reduces blood viscosity and prevents further sickling. Supplemental iron, activity restriction, and a high-protein diet are supportive but secondary to ensuring proper hydration. For suspected meningitis with a positive Brudzinski sign, placing the child in droplet isolation is the priority. This prevents the spread while diagnostic testing is arranged. Administering analgesics, starting IV fluids, and preparing for lumbar puncture follow isolation measures. In iron deficiency anemia, giving oral iron with orange juice is correct. Vitamin C enhances iron absorption, while dairy products inhibit it. Administering on an empty stomach and brushing teeth are supportive but secondary to ensuring optimal absorption. For burns covering 25% of the body, initiating fluid resuscitation is the priority. Fluid loss can lead to hypovolemic shock, making resuscitation essential. Pain management, topical antimicrobials, and monitoring urine output are important but follow fluid stabilization. In asthma with sudden absence of wheezing, notifying the provider immediately is crucial. This indicates severe airway obstruction and impending respiratory failure. Administering bronchodilators, providing oxygen, and reassessing are supportive but follow urgent notification. In suspected appendicitis with sudden pain relief, notifying the provider is the priority. This may indicate appendix rupture, requiring immediate surgical evaluation. Preparing for discharge, offering fluids, and reassessing are secondary to ensuring prompt intervention.